Welcome to the second in the series of COVID-19 experiences, effects, and expectations organized by the Jewish Medical Association. We had an introduction last week from Ellis Friedman, which you can access on your link, and describing whether or not we were worse than any other country in relationship to our handling of the pandemic. We're now turning to the other side, and to the other side is the patient experience. And as we all know, if you're members of the Jewish Medical Association, the patient experience, of course, is something that's absolutely vital in medical practice in 2020. And it's a unique opportunity to actually have somebody who's had the patient experience and who's had the patient experience, as it were, all the way through, and is well and alive and kicking and ready to tell the tale. Yes. And of course, it's personally a great pleasure to have Laurie, because he's a great friend and partner in crime at the same synagogue and the same minyan, and over many years. He's been a kind of kindred spirit in that minyan, and therefore the period when he wasn't there was actually very notable and very notably missing. Now, just one or two business announcements that we're building up and getting more organized for the series as we go along. Next week, we will have, at the same time and place, Karen Moshal, who will be talking about children and COVID-19. The week after that, we've got Marcel Levy, who's chief executive of UCLH, who will be talking about his experiences as a professional running the show. And after that, we've got Mervyn Singer, who is the first person to work on one of the new pieces of apparatus that this has generated. So we're building up, and the positive side is that the series is now recognized by the Royal College of Physicians for continuing professional development. So you can get your certificates when you complete the feedback form. But also, in addition to being recognized for that purpose, they've asked us for having a conflict of interest statement by the speakers. So, so I'm assuming that I can reassure them that Laurie doesn't have any conflicts of interest either with the hospitals, with any of the drugs that are being provided, with any of the equipment that was used. I'm just assuming that that is true.
I'll have to declare, I was going to mention a declaration and disclosure actually in my opening remarks, which I can declare, but I'll be pleased to do that in a moment.
Fine, all right, okay. So, Laurie, we're here to listen to you, not to me. Look forward to hearing from you.
Oh, good evening, everyone. So as you probably know, my name's Laurie Wiseman. Now, a couple of apologies. First of all, my voice is not quite what it should be. That's some 12 weeks after intubation. It's still repairing itself. So I apologize if I'm a bit husky. And that explains also the use of headphones. It's a bit more easy for me to speak rather than shouting at the screen. And I'd also like to thank Professor Katz and the JMA for inviting me to this, because it's a rare pleasure. I can't see you in the flesh, so to speak, but it's a rare pleasure to address such an esteemed and noble gathering. I'll begin with a little bit of background about myself so you get some context. When I was taking my A-levels, I was seriously considering being a medical student. In fact, I applied to Guy's Medical School with 2 science A-levels, in the hope I could do what was then a conversion course to make up for the lack of the 3rd science A-level. But I decided that I lacked courage, I think, to take on a medical career at that age, unlike yourselves. And I instead studied English University, became a journalist, and worked in broadcast journalism for a number of years. And quite by chance, in the course of my travels, I came across a gentleman who'd been working with UCL and their medical physics department on some surgical simulations using very high-end, at that point, 3D computer graphics. This is about 30 years ago. And as a result of that chance meeting, I founded with him a company called Primal Pictures, which eventually developed the world's first complete 3D anatomical model based on things like the Visible Human Project, our own scans of live and dead bodies. And we worked actually very closely with UCL and the Royal College of Surgeons on that project. So it's a kind of full circle for me. That company is now owned by another business called Informa. But it's a great pleasure to address a medical community like this. I haven't done this for a number of years since Primal Pictures was acquired by Informa. And also for full disclosure, since that time, I've been involved in advising and supporting a number of businesses. One of my current ones is called Infinity Health, which is developing and has developed sort of care coordination and task management software for both the care in the community and hospital settings. It's currently being used in Northwick Park quite heavily. We have ambitions for it to go across the NHS, but for full disclosure, I should mention that. And I will mention in some of my later remarks what I feel is a potential role for digital health products to ease the plight or sometimes the mental suffering, I think, of the patient. And I would encourage you, by the way, to interrupt via chat or messages to David with questions, because inevitably over the next half an hour or so, my voice is going to get strained. So a little interruption would be most welcome. So please fire questions. I'll tell you the story of my illness. So 2 weeks before lockdown, a week before lockdown, on March the 15th, I became very ill and admitted myself and walked into the A&E department at the Royal Free. For the previous week, I'd been feeling unwell and was isolated at home. But that Sunday, I suddenly got a very rough throat. I felt really unwell. And having phoned up 111, they said I had a choice. I could either wait 5 hours for an ambulance or walk into an A&E myself, because I live very close to the Royal Free Hospital. And on admission there, they said, it looks like you've got COVID-19. I was put in a bay in A&E and spent all night there. My wife kindly sent him some food for me to eat. But basically, I spent the whole night awake, being successive diagnosis and having blood tests coming backwards and forwards. I remember seeing some results later, or talking about them later, because I'd had some kidney infections earlier. So I knew vaguely what a CRP was. My CRP at time of admission was around 220. So it was pretty damn high. At about 6 o'clock the following morning, and this is where it gets a bit hazy, because my memory of actually what happened, which is interesting in itself medically, gets very hazy. I was sent up to a ward, the 12 North, I think it was, into a private room. Not that I was exercising any Protexia or private health insurance. I was just sent in this private room. And I messaged my wife at the time saying, I think I've arrived in heaven, having spent the best part of over 14 hours in A&E with nowhere to sleep properly, just a sort of a makeshift treatment bed. Now it gets very hazy, because within about 2 or 3 hours of arriving in that ward, I think I collapsed. I don't know, because I have no memory of what happened in the next 5 days. What I do know was reported to me afterwards, mainly by my wife, because after I got out of ICU, which was where I was heading, my wife told me afterwards, and I had a very bad voice at that point, but I managed to talk to her, that I'd been on a ventilator. And at that time, which was a week or so after I'd come out of ICU, I had no idea I'd been on a ventilator. None of the doctors had told me, or if they had, I had forgotten. So I went down to ICU, and you may have had the privilege of seeing that wonderful documentary about the Royal Free, the two-parter that was on about a month or so ago on BBC Two. So I now know what the ICU unit itself looks like, because I have, again, no memory particularly of that. I was put on a ventilator, and I was I guess, a very early patient to go on the ventilator, because this was the first day of lockdown, March the 23rd. And it's somewhat ironic we're talking today when all these lockdown measures are being eased and we can go into a pub, thank goodness, in about 2 weeks' time. At that point, it was the first day of lockdown. And clearly, I had caught this disease partly because lockdown had not been enforced earlier. There's no doubt in my mind I probably caught it on the underground or some crowded spaces I've been in the week before I got ill, which is the week of the second week in March. So there I was in ICU that I don't remember. But, and I don't know how many of you have had experiences with patients of being on a ventilator and being in what I guess was a semi-coma. But my memories of that period are dominated by both semi-hallucinatory and very strange experiences because of both the drugs I was on and the pain I was in. I began to imagine my own death and funeral. I could see my children, my two children, they're 23 and 25, Jake and Isabel, and my wife, Charlotte, sort of gathering around, crying. I could hear them crying very, very clearly next door, wherever I was. And then I imagined my own funeral. And at one point, it was so painful, whatever pain I was in, I was somewhat aware of pain, that I just wanted to curl up on the floor and die. I remember that feeling extremely vividly, that there was seemingly no escape from this situation, of which I was sort of unaware of precisely what it was, of course, but I knew I was unwell. I just wanted to curl up on the floor and die. And then at some point, and it may have been that I'd been moved, but I had this sense of being pulled away from whatever those thoughts were by two forces on my shoulder. It was I relate it as a quasi-religious experience, but people tell me afterwards I was probably being moved on the bed. Nevertheless, at that point, seemingly I was feeling better. And my discharge note said, and I should have brought it with me here, but I was put on a very high dosage of antibiotics by that point. And that's when I turned the corner. It must have been day 3 or day 4 of being on the ventilator. I will tell you one other very funny hallucination. And the strange things about these hallucinations is they are extraordinarily vivid and detailed. Oh, by the way, the other fact about visiting my own death was I had this very strong sense that I could write down some notes between my death and the funeral that somehow will get in the hands of my wife and anyone that attended. And I was aware that not many people could attend because of the virus. I was aware of that, and that somehow I'd write some tributes to friends, and particularly my family, that I had somehow time to write even after my death. And I was even planning what to say. It was most bizarre. I don't know how these hallucinations happen. It's very interesting medically. And I spoke to a psychotherapist who happens to live in our road about this, and she says they can be very revealing what you dream about. I dreamt that a famous footballer or athlete, I think it was Justin Fashanu, I can't be absolutely clear, arrived in ICU, and I saw him arrive somehow in the back of a private ambulance, and he was writhing in agony on the floor. He arrived in ICU, coughing his guts out, but magically by the next morning he was better and offered me a cup of coffee, which clearly I couldn't take, and told me about his engagement that morning, that he had to go somewhere for a public speaking engagement. In the meantime, I imagined all these paparazzi were trying to get into ICU, taking pictures of him. This was indeed so vivid that after discharge, I said to my son, Jake, well, you must have read about this in the newspapers, because they were trying to take pictures. There were all sorts of things going on. So my phone just gone off. They were trying to take pictures. It must have been in the local press at least. And my son said, what on earth are you talking about? It clearly didn't happen. So after 5 days, I moved into what they call recovery 2, which is still part of the ICU broadly. at the Royal Free, and I spent roughly a week there. And that's when David won't mind my telling this story, because I was now semi-conscious and aware of what was going on. And now I was on the CPAP, which is the most awful thing, because they wrap it around you extremely tightly, as you probably know. From the patient perspective, it feels like you're drowning. It feels like this thing is on your face. All you want to do is lift it off to be able to breathe. It's forcing breath down and you can hardly breathe out. And I had that on for almost all the time I was in the recovery ward in ICU. But then I was compos mentis enough, and I had a tiny voice at this point. And I, I think this is perhaps why David has asked me to talk. I said, the only person I want to see is Professor David Katz. That's the only person. David Katz, please call for him. He's at UCH, UCL. You must get hold of David Katz. They could barely hear me through my breathing mask, and I took it off. I could barely speak. I managed to get some form of words so they could distinguish the name. And I had this image. So clearly, even though I was in recovery, I was still somewhat delirious, that David would come in and somehow rescue me from the situation that I was in, which was still, I have to say, somewhat unclear to me. I really didn't know how ill I'd been. I didn't know that there was only a 30% chance of getting out of the ICU, having been on a ventilator. That was a statistic I was told later. Moreover, I didn't know there was only a 20% chance of coming out of ICU, having been on a ventilator, with basically intact lungs, which thank goodness I have, although I'm having a scan next week, so I'll be able to tell you more then. So in ICU, I came across, I was managed to talk to the doctors for the first time and hear what they were saying. Jim Buckley, who is this outstanding intensive care consultant at the Royal Free, and I'll never forget this moment, took my hand and said, I looked at him and said, Jim, am I going to live? And he said to me, no bullshit, you're going to be all right. And it was that directness from the doctor that was the moment of reassurance that I was actually looking for. It was, he had this innate sense of authority. One trusted him. Heaven knows how he does his job, particularly in that particular environment at that particular time. So I pay huge tribute to Jim and indeed his colleagues, but Jim was the sort of master of ceremonies down there in recovery too, that looked after me and reassured me. Because bear in mind, as a patient with COVID-19, one has very little contact with the outside world. My wife at this point was able to ring into recovery to pass messages to me, but I wasn't able to talk to her, partly because I couldn't speak, but partly because the phone was on the other end of the ward and it couldn't move. And also, as an aside, by this time, the hospital, which in other respects was extraordinary, had lost all my personal belongings, including my mobile phone, my glasses, my spectacles, everything I brought in with me. So I was half dead and half blind by this point because I was so short-sighted I really couldn't see what was going on, which in some respects, I must admit, was a huge blessing. I never really, whilst I was in hospital and could speak later, asked for my spectacles because I, in some respects, didn't want to see what was going on. I was in my own very small world. So after being on the intravenous antibiotics and various other drugs they gave me, heaven knows what they gave me, I turned the corner, as it said. I made a I can't remember what it said in the discharge note. I made a rapid recovery. Well, what recovery? Use another word. And I was sent up to a ward. And I remember the moments waiting to go up to the ward and just getting out of ICU. It seemed to take hours. Indeed, it did. From the moment I was told I would go to the actual moment I went up. And I can't tell you as a patient what it means to be on a ward out of recovery, because all you dream about is the recovery two in the Royal Free was in the basement. So I didn't really see daylight for 12 days. I didn't know, but almost didn't know it was day or night. There was chinks of light coming in. I could almost see, but it was very disconcerting. And it was only my second hospital visit. I'd been in before, 6 years before, for a kidney infection. But other than that, I'd been extremely well. And by the way, I should have mentioned the context for my illness is that I had no pre-existing conditions. I'm fit and healthy. I'm not obese. There was no real reason for me to get this virus in this way. And since I'm on that subject, people tell me maybe my viral load I got from someone was very high. Perhaps there's a genetic element to it, to why I'm was more predisposed to it. My father had pulmonary fibrosis, but I don't have that. It's not generally genetic and passed down. So, but maybe there's something. My mother died actually of community-acquired pneumonia, but she was already quite unwell with other things. And it is ironic that both my parents died of lung disease, and it's not ironic, but it's sad. There seems to be, could be some connection. So I went up to the ward, and the ward was fabulous. I was given food for the first time because I was on a feeding tube down in recovery. The only thing I did wrong when I was there and not obeying doctor's orders was when I went up to recovery, when I went up to the ward, I still had the feeding tube in. The feeding tube is the most horrible experience. It rubs against your throat and no doubt caused some of the irritation to my larynx, which I'm still experiencing. And I hated the feeling. So one evening, having been up in the ward, I think a couple of days, or maybe it was in recovery too, I can't remember. Anyway, I pulled it out. I felt like some kind of very naughty boy, but I did. I admitted my crime to the doctor that came, and they tried to reinsert it. I said, I just don't want it. I think I can begin to eat fluids now. And they tried a couple of times. It was too painful, and they gave up, thank goodness. And I began to have thickened fluids, and gradually, mashed up food, and eventually I began to be able to acquire a small voice. About a week after I was in the ward, I had a voice, and I was able to talk. And I would say that my observations about being on the ward, once you're more aware of what's going on as a patient, are twofold. First of all, certainly at that point in the Royal Free, there were loads of staff all the time, and they were coming in doing the observations, and I was seeing all sorts of medical staff, but I did have no idea who was my lead consultant, who was actually then looking after me, who was the person I would turn to for the ultimate piece of advice or information. I learned afterwards that on the discharge note, it was Professor Keith Moore. I think he's written some textbooks on acute medicine, as I learned afterwards when I looked him up. I don't believe I ever met him. It was quite strange. That's not really to criticize the hospital. I think they know that everyone was doing all sorts of jobs during that period of crisis, and everyone was being corralled into helping in areas of speciality which were sometimes unfamiliar to them. But I think I saw one respiratory specialist. The rest were either general medicine or come from other range of specialties to talk to me and advise me about my progress. It was, as a patient, I think one needs a reassurance, particularly when you've been that ill. And I had no idea really how ill I'd been, which is quite interesting as well. Really, I really had no idea about the statistics, and really until after I was discharged somewhat, how ill I'd really been. They said I'd been poorly, but they didn't tell me how close to death in some respects. So I wanted that reassurance, and in some respects I didn't get it. And I think, particularly because there were no visitors allowed, and I could talk to my wife maybe towards the end of my hospital stay, once I could begin to talk on the phone. The psychological distress of being in that situation perhaps is not fully appreciated. It's probably appreciated, but it's not, you know, one wants to communicate feelings. One wants to say, you know, every time a doctor came up to me, I'd grab their covered hands, you know, their gloved up hands. And of course I couldn't really see their facial expressions because of the mask. And often, even physiotherapists, I would say, oh, I'm so pleased to be alive. And I almost began to cry many times, many times. It's a hugely emotional experience, this illness. And there's no doubt that, and I know it's been documented about delirium. Certainly my family said and I agree with them, when I came out, I was still somewhat delirious and unable to, you know, string sentences together, have clear thoughts, was still very emotional and still caught up in the vividness and the terror, I think, of part of the experience, which gradually began to dawn on me that these hallucinations that I had earlier were caused by being on these very powerful drugs and being, you know, so severely unwell. And that whole process has been, for me, a realization of kind of what I'd been through. But there are some almost tiny things I would mention that once I got up on the ward, I was coughing virtually all the time. I was in a ward where the 3 other patients were in better shape than me, hadn't been in ICU, but were still poorly enough to be in hospital. And certainly hadn't been on a ventilator. None of them were coughing, but I was coughing all the time. And I was terribly conscious of this, and I needed tissues all the time. And I had to constantly ask the nurses as they were passing for tissues. I know it sounds pathetic, and indeed it is in some respects pathetic, but all I desired at that point was my own box of tissues so I could privately cough and not disturb everyone else in the ward. And somehow those small things, which seem tiny at the time, and your purview as a patient with this is so limited in some respects. You're trying to get through each day, and particularly each night, with the least discomfort and the least pain. That those sorts of things have immense meaning. And I was contacted by the Royal Free afterwards to get some feedback on the patient experience. And I spoke to, amongst others, their head of nursing, who featured in that wonderful documentary quite heavily. And I said, you know, I got superlative care. I got the most, you know, they undoubtedly, without doubt, saved my life. And if I'd left it another day to go into A&E, I could well have collapsed at home and it would have been much more serious. And they saved my life. But there is this sense of, I don't know, compassion. And that's a hard word to use with doctors about, and you know, that do the most incredible jobs. But it's this compassionate sense about what it's like sitting there as a patient, coughing all day long, and saying, "You're going to get better. You're going to get better. You'll go home soon." It was unclear whether I was going home in a month or 2 months. No one could really tell me. But I was sitting there thinking, this cough is never going to end, and that was very hard to deal with psychologically. And then I remember I began to eat, could eat solids. And then a junior doctor came up to me. This is a good example of sometimes the lack of fellow feeling is, he said to me, well, Lawrence, and they called me Lawrence there, not Laurie, because that was the name on my tag. You're going home tomorrow. And I said, still coughing, I can't go home tomorrow. You're mad. I feel terrible. I can barely walk. I'd done about an hour of physiotherapy, could take about 3 steps, then had to hold on to things. And I looked in immense jealousy to my fellow patients on that ward that could walk to the loo. I can't do this. You know, I'll be an invalid at home, which my wife was extremely worried about. And I understand that fully. So I then beckoned all the nurses and everyone else. I said, I can't go home tomorrow. Give me at least another day. Let me walk a bit more. Let me, you know, I had to almost plead to have a day's grace so I could at least feel a bit stronger. I could feel myself slowly getting stronger, but I needed an extra day. And thank goodness they gave me that extra day. And it did make a big difference because I could plan in my head by that time, having been in hospital 3.5 weeks, what it was going to be like being home and the emotions of that, that reciting of my body, which didn't quite feel like it belonged to me at that point. So I went home on the 16th of April. I was due to go home at 4:30. That's when I was told the transport has arrived, but I could, even without my glasses on, I could just about see the clock on the wall, and it was coming down to about 7:30, and it was a Thursday. And you may recall on Thursday evenings, people would come out and clap for the NHS, which I had, my wife had told me about that this was sort of going on, and she was joking that maybe you'll be around when the clapping starts. And lo and behold, I was lifted in because I couldn't walk, and I had to be put on a not a stretcher, you know, the portable wheelchairs into the back of the ambulance, and they transported me, you know, half a mile to my home, and it was exactly 8 o'clock as I arrived, and the doors of the ambulance opened, and there was this massive round of applause of people clapping and banging drums and banging backs of saucepans. And I came out the back of an ambulance, and I will never, to my dying day, forget that moment when I was welcomed home, and that sort of soaring sense of I'm free and I'm home. And it was just extraordinary, and people were crying in the street. They know I'd been unwell. My kids and my wife obviously came and greeted me. I didn't cry myself. It was very interesting. I was sort of overwhelmed, completely overwhelmed by the experience. Lifted up the stairs to our house, lifted up the poor paramedics didn't realize we had a lot of stairs to take me up, and they, to use the term, schlepped me up and put me on our spare bed, where I remained and coughed for the next 3 or 4 days. And the doctors in the Royal Free said that the clinical evidence is that when you go home, you rapidly get better. And I didn't believe them, but they were absolutely right. Within 2 or 3 days, basically my cough cleared up. It was quite miraculous. I was still breathing very heavily and was, still not feeling well at all. But I was able to sleep for the first time, not coughing all night, because I basically hadn't slept for 3.5 weeks in hospital. And I'd lost 10 kilos in weight. So I looked a pale of my former self, shadow of my former self. But within a couple of weeks, I was building up my strength to the extent now that, as you probably hear, I'm not. 2 weeks ago, I was breathing in between sentences and you could hear my breathlessness. So that's not the case now. My voice is okay. It stood up this particular presentation quite well, I think. It's now 9 weeks since discharge. I can walk up the hill without getting breathless. This is the last week. And I am hugely blessed and hugely grateful that I survived. The remaining symptoms is a slight sore throat. When I first came out, I had also intense nausea, which I know is a common side effect of a symptom of COVID-19. I decided to come off. I was on, what's the drug you take for reflux? Omeprazole. I was on omeprazole, and they also gave me some high protein supplements. I decided, I took my decision, I came off all that. I said, everything's making me feel unwell, I'll become drugless. I'd also had a suspected urinary tract infection when I came out, when the catheter was removed. So I was on some antibiotics, and when I came off that about 4 or 5 days after I got home, I came off all drugs. And again, by some miracle, the nausea lifted. I spoke to David at the time about the nausea, and he told me it's like being seasick and you come on dry land. It takes a while for it to pass. And actually that piece of insight and advice made me feel a lot better. It's about, it's referring back to what I said about the doctors around you giving that reassurance is, I think, for me, very important for this kind of disease, where as a patient, you feel totally sort of out of control and all sorts of strange things happen. So all that passed, and I'm basically okay. I've been able to do bits and pieces of work for the past 2 or 3 weeks. I can't, if you told me next week I'd have to have a solid week of running around or doing work or whatever it was, I said I couldn't take it. I'm not ready yet. And they told me about 3 months to get fully recovered. And I guess that's where I am. I'm hugely fortunate that that I didn't have dialysis. I didn't have anything wrong with my heart. I've had funny symptoms of tingling, by the way, nerve sensations at the bottom of my feet. That's all COVID related. I've had some skin infections. I've got a red nose at the moment from a skin infection that's cropped up since I've had COVID. So you don't quite know what is going to crop up next. But I think I've got through most of. I dare to mention this because you never know. I think I've got through most of the lingering symptoms. Although you as doctors know as well as me that no one knows. No one knows what the burden on the health service is for people like myself going backwards and forwards. I had a couple of weeks ago a swollen ankle, and I phoned up my wonderful GP Daniel Gordon at the Keats Creek practice around the corner here. And within, actually it wasn't Daniel, it was another one there. Sorry, I beg your pardon. Anyway, they're all wonderful doctors there. And within an hour, because I'm a sort of a high risk patient, they were scanning my leg for ultrasound to make sure it wasn't DVT. Indeed, it wasn't. But who knows why my ankle swelled up like that? No one knew. It was swollen for about a week. It's gone down. Who knows what the cause of that is? So that's kind of my story. The last coda perhaps to it is I mentioned about the lack of clarity on treatment sometimes, or where I was in the recovery pathway, and I think that's true. I also think that I'm a great fan of digital health, as you know. I mean, this is not an advert at all for the sorts of things that I'm involved in, but it's interesting that the Royal Free in its response to me in terms of that patient response group they set up. They say now they've got iPads on the wards for patients to contact their loved ones whilst they're on the ward. They make sure that the family is contacted on a regular basis, even, and given regular updates, as are the patients. That wasn't really happening. The role of digital health and digital hardware like that, I think, is immeasurable. And as the health service goes through a digital transformation, one of the things that's should be borne in mind is that, as well as the clinicians having access to the tools, I think it personally would be wonderful if the patient had a consistent view and constant view of his own treatment, his estimated date of discharge, what his treatments are, what he's currently on, so that there's a sense of, not control is the right word, but a sense of overview of where you are as a patient is psychologically very comforting. And that could be done on a digital, on an iPad or even on the patient's own phone, that could inform the patient of quite where they are. So that's my final sort of small message about where the health service could go. But I don't know what the time is. I've been whittering on. Are there any questions, David? I can't hear you.
I'm going to unmute myself, right?
Oh, yes.
Well, first of all, thank you very much. And I just want to tell everybody that when we had the pre-conversation, Laurie said he would speak for 5 or 10 minutes and then take questions. And his son said it would take considerably longer. Your son was right, it did take considerably longer, but I think it was worth every minute of it. And it's the proof of of the degree of your recovery that you managed to do that without noticing and complaining. Now there are questions. Okay. First of all, starting at the beginning, the one question is whether what your family were told about their isolating. Were they told to isolate
yes, they were, because whilst I was in hospital, again, unbeknown to me, this was a very early stage that both my wife and my wife felt ill and had a sort of cough. My daughter lost a sense of smell. She's 23, and she lost a sense of smell and also felt unwell for a few days. They both, we've had the antibody test, and they both tested positive, as it happens. And so they were isolated, yes. Yes, they were.
They were isolated, right.
Yes.
Also, you mentioned, you've discussed the question of underlying health conditions, which was another question. You mentioned your general practitioner, the role of the general practitioner in this.
Well, it was post discharge. It's been critical for me because I've had all these strange symptoms that I've gone to my GP with. I think more importantly, though, during my period in hospital, Dr. Daniel Gordon, who's one of the doctors at Keep Street, was in constant touch with my wife, because there were certain periods where my wife was not getting feedback from the hospital, particularly whilst I was on the ward and during recovery. There was very little feedback, and it was difficult to get the latest information because whomever picked up the phone would not have access necessary to my record and where, etc. So, but Daniel was very reassuring about it. He knew basically where I was, found out where I was in the recovery pathway, and was extraordinarily reassuring to my wife. And she says that it would have been impossible without him. And they told me afterwards they got 13,000 patients on their list in our local GP's practice, and I was the sickest patient on their list. They had more elderly patients that were unwell and were very sick, but weren't on ventilators. So I had that rare accolade. And so as a result of that, I think particularly, and Daniel is a particularly wonderful GP, that my wife was being reassured all the time. And it was horrible what my family went through. You can't, to very suddenly be told that your husband and father may not last the week out of the blue is not very pleasant.
Now, the turning from that, do you know by any chance whether you were on dexamethasone?
No, I wasn't. I was only given the puffer, Beckinase, yeah, on the ward. And I knew that from my father's pulmonary fibrosis, that the only thing that kept him alive was steroids. And I said, surely you can give me some steroids to help relieve this was sort of early April. Surely you can give me some steroids to relieve the congestion and the inflammation in my lungs. And they said, we're not prescribing steroids at the moment. We can give you the puffer. Okay. And the inhaler had no effect whatsoever on the cough.
Right.
None whatsoever.
And there was the question of why you were given, said you were given antibiotics. Was that part of the routine care, or was there
No,
any?
I think they on the scan, as well as a viral pneumonia, I had bacterial pneumonia,
Right.
and I think that's maybe why. I mean, I was at home for a week with the virus, and clearly there was a bacterial pneumonia brewing there somewhere as well that came out, and that's presumably what caused my collapse. I mean, David, I have no idea why I collapsed, but I have no memory. I mean, I know a lot of people, a lot of patients do have memories of going down to ICU and sort of being gently put to sleep and put on a ventilator, whatever it is. However the process is, I don't know what happened.
Now, that's an interesting, because a question has been asked about that as well. Because you say you have no memory.
Yes.
The question asked is that the one thing you did mention is pain.
Yes.
Now, how does that fit?
I don't know. I don't know. I'm in my mind's eye now. I can see myself, and I had this image of myself writhing on the floor, curled up in pain. So somewhere my brain was processing what I was going through, and I don't know, David, whether one is semi-conscious on a ventilator, whether there's a degree of awareness, but certainly I was at certain points, and this came back only fairly recently. In my mind's eye again, I saw these nurses and doctors moving around in a sort of with a blurry background, and I could see. I don't think that was a hallucination. I could see them in full PPE, and I could see them there moving around, and obviously moving and adjusting the drips and whatever else I was on the ventilator. So it's the degree of consciousness of what I was going through is a really interesting question, and and envisioning one's own death, whether that was because I knew I was ill before I got down to ICU, whether I was taking these feelings with me into ICU, but I wasn't actually experiencing the pain because I was on, all the sedatives and everything. I don't know, but
There's a question about pain. I mean, the pain was general. It wasn't specific to any particular, the sense of pain.
that's an interesting question. I think I felt pain all over. I think the pain of not being able to breathe is a sensation of the whole body just packing up. It felt, that I mentioned about the sense of drowning. It does feel like that. But I felt that most intensely with the CPAP. The CPAP was so tightly on my face, by the way, that it cut into my nose, and I had blood running from my nose at some point. And they may have adjusted the mask. Boris probably didn't come out with a cut nose like me. He was on CPAP as well. And the other thing, the tube, I understand the tubes they put down you now are smaller tubes. So there's less danger of damage to the larynx and other parts of your tubes down there. So it could be some of the pain was associated with that, which if I were a patient today, I may not have experienced in the same way.
Now, there's a question about smell and taste. Did you
Yes.
have disturbances of smell and taste?
I didn't actually. I could taste the hospital food, which probably that was what's the word for mashed up food? Sakes me anyway. Yes, that food was utterly disgusting, and I could taste it.
Right. There's a question about the fact you described the sense of not doing day and night in
Yes.
recovery.
Yes.
Do you remember differences in the monitoring that was going on between the initial period and the recovery board? With people checking on you, monitoring you, with you? more or less in
Well,
which?
they're constantly with me in the ICU and recovery. ICU, I don't remember at all. Recovery, there were nurses around all the time, and they were tremendous. It's tremendous nursing staff. And bear in mind, I had to have everything done for me. This is not a pleasant experience. And the first time in my life, all this needed to be done for me. And I won't go into details, but they were immensely caring. They understood what I was going through, and they were always on call. On the ward, however, the staffing was slightly more sporadic, and I was constantly pressing the bell because I needed help. In whatever context, and the distress of waiting as a patient like that, and trying to both control your coughing on one hand and control other bodily function on the other, is not pleasant.
Have you been put onto any trials at all?
Trials of
Trials of medications or anything like that,
what?
post-operative?
No, nothing at
Vaccine?
all. No, I'm seeing a respiratory specialist, actually talking, not seeing him, of course, this week. It'd be interesting what he says, and I'm having a lung scan next week. So there may be some stuff there, but I'm on nothing at the moment. And my recovery has been, by all accounts, pretty rapid, with no pharmaceutical interventions.
There is a question: is the structure of your continuing follow-up? People are interested to know, what's the actual plan that
I
you?
don't know. That's another question I'd love to know the answer to. I've done a lot myself, to be honest. So, I'm fortunate to have some private health insurance. So I decided I would get some physical therapy because I knew I really couldn't walk properly and I needed some help. And the physical therapist at the Royal Free was terrific, wonderful woman called Natalie Gordon. But I needed some follow-up. I needed to know what to do. They sent me home with a Zimmer frame and that was it. So I got some private physical therapy and that really, really helped. So I had to make it up myself, to be honest, David. I was half expecting some Zoom calls from some physical therapists or some follow-up from the physical therapy department. The only substantive follow-up, I've had two. One is a letter from the nutritional department at the Royal Free, nutrition experts, saying, you left hospital malnourished, you should take Meritine, which is the supplement. And that was it. That rather phase. I didn't realize, I wouldn't call myself malnourished, but clearly I wasn't eating very much and I'd lost a lot of weight, but malnourished somehow made me feel even worse. And the second was a call I had today, which is some 9 weeks since discharge, from the bookings department of the Royal Free saying, come in for a scan next week. So, and as I said, I'm seeing a specialist this week, so part of the same thing. So it's been
Okay.
The recovery's been self-made, essentially.
Right. Now there are a couple of questions about the technology. The technology issue. You weren't given you didn't have your mobile phone was lost. Is that
correct?
Yeah.
Correct.
So what technology did you use? Were you given something by the hospital?
No, there was nothing at that point. I had to use the phone that's attached to the bed. The patient
actual hospital phone, in other words.
Yeah, well, they have them on the bed,
Yeah.
You can make like it costs like £1 a minute to make a call out for something stupid. So I refused to pay that silly. So my wife will call me. There's occasionally I called out if I feel I need some reassurance about something. But that was our means of communication. And to be honest, during my hospital stay, my voice was very difficult to understand over the phone.
Right.
I mean, it's so, as you can hear, it's okay now, but it was literally less than a whisper.
There was then a question about in relation to that. Does your wife remember telling you things, and you can, she tells you, and she has to repeat it again the next day because you forget.
Now since discharge.
Yes.
Oh, yes.
I mean,
She will confirm. She's upstairs.
yes.
But I've called it post-COVID delirium.
Yeah.
And I think I spoke to you shortly after discharge. You kindly called me. And I said, my brain is just not functioning. And the cognitive ability to think properly and clearly had gone completely. Now, that's partly because of sleep deprivation. But it wasn't just that. There was something going on, and there still is. I'm not, I'll miss stuff and it's not old age yet. This is, I'm just not quite there. It's interesting.
Right. Then there's one other question which, takes you back to your, as it were, your day world. And I think we'll have to let you have a rest after that, which you've certainly earned. And that is the question, apart from, well, there are two questions, sorry.
Yeah.
The one is, if there's something digital that you could suggest from your day, do you think that you could offer a suggestion that something that you know about from your previous incarnation, from digital health and so on,
Yes.
that would, the biggest thing that would make a difference?
Well, I think for any sensible patient, they want to, I mentioned this earlier, and I'll reiterate it, they want to know what's going on.
Yeah, but how technologically?
Well, you see, I think what can be given to a patient is just an overview of where they are, with regular updates. You want to know what your estimated date of discharge is. You want to know that you'll see a physical therapist twice a day, and approximately these times. You want to know that the doctors will visit and come round at approximately this time. That there's some kind of structure that you can see and reflect on and see it's happened. And I think that's a very simple, one has that in the rest of one's life, and it's called a diary, or it's called a list of daily tasks that one goes through. And somehow when you're a patient in hospital, you're thrown into this maelstrom of complete uncertainty and complete lack of any control over one's own life. And that's extraordinarily disturbing for anyone that's got a degree of sense and sensibility.
I think the question's asking, yes, agreed that that's what you want. What piece of tech does the patient need and the hospital need to deliver?
Well, that's the whole point. The tech's in the patient's hand, and that's a mobile phone, a smartphone. Everything can be delivered on that device. They need nothing more than their own phone, and possibly access to the Wi-Fi on the ward, and that's it. Everything else can be delivered through that device, as we're delivering almost everything else through those devices these days. That's my belief, and I'm not plugging any kind of digital health company that's doing that, but clearly that's what patients want. And I'm sure in 20 years, 10 years time, 5 years time, the handover sheet, the patient list will disappear. There'll be something else in its place, and there'll be a patient-centric version of that gives the patient a sense of what they're in for, as I said, the treatments and the regime they're under, and that will be immensely comforting, both for the patient and their family. One other thing I noted there is a very interesting question is, for cardiac patients, there's often a patient rehab support group.
You've got to read to the end of that question, please.
On this guy's COVID brain, would you feel you could run a country if you needed to? Oh, that's from Liz. I won't answer that question, but I will answer the question that there does need to be some COVID support groups. It's you and I know a gentleman in his 50s who was on a ventilator for, 50 days or something horrific, is now back home. Gosh, we need to talk to each other. And I think there's there is a sense that I've been offered, you know, psychological counselling and these sorts of things. No doubt I'll take up some of it, because the experiences are extraordinarily vivid, often very disturbing, and stay with you.
I think that's a good note to end on, because what we asked in the series was experiences, which you've told us about, effects, and also what should be their expectations. And you've given us some insight as well into that third aspect.
Yes.
For which I think everybody here has to be very grateful.
Yes. I'm worried like you about the loosening of the lockdown rules as well, because clearly I was a victim of the lack of lockdown. So I'm still very worried about the consequences, and it will be very interesting to see what happens over the next weeks and months.
And the other thing is that, of course, is that also on the site is we have the message that, of course, the Royal Free is looking at lungs and also at kidneys and doing the long-term follow-up.
Yes.
And so you will be hearing from them.
I mean, in some senses, the less the better. You know, I'm grateful for being alive, and I'm just hoping everything is still in working order. I want less information right now. I'm just happy to be here.
Okay. Sense. Thank you very much. Thank you.
Thank you, David. Thank you, everyone. I hope that was entertaining.
And that was not more than entertaining. It was informative, educational, and very humbling.
Thank you. Thank you, everyone.
Thank you. Good night.
Good night.